How you doing? Dr. Barton coming in from Fargo.
Just crawl out of bed.
That's how he crawls out of bed, and that's why he's here. So, wherever you're watching this from, whether it be on Facebook, Instagram, YouTube, wherever it is, I'd like to formally introduce you to a business partner and a friend of mine, Dr. Barton. I had the gracious opportunity of being introduced to him a few years ago, and not only have I learned a lot from him, both in regards to the medical field, but also in terms of how to run a business. But he's had the opportunity to teach over, I don't know what it is at this point, maybe 200 offices or more. Him personally has mentored, taught, and set up a lot of the offices that we've worked with that have integrated Shockwave. And so we've taken, really what he's replicated in his office, which we're going to talk about today, and you're going to find out why it's, so impressive. And he's been able to teach other practices all throughout the country in every major state, how to do it in their office. And so what we're going to do today, what we're going to talk about today is, first and foremost, we'll give you a background on Dr. Barton. I'd love to just kick off with, who you are, where you came from, and all that stuff. And then we'll get on to some of the more exciting stuff, which is, why did we integrate Shockwave? What had you looking into this? What problems were we looking to solve? And how are we using it here today? For context for everybody here, most people on this call are looking into this technology for a variety of different reasons, whether it be the fact that you're trying to understand if there's a better way to care for your patients, a better way to help your patients heal sooner and faster, help address conditions that maybe your office is having trouble addressing right now, or you're looking for a way to take your business to the next level. We're going to be answering all those questions. And in the last 15 to 20 minutes of this, we'll answer any questions that you guys have. So if you could save your questions for the end or just shoot them in the chat as they come in, that would be phenomenal. But without further ado, Dr. Barton, it's good to have you here. Why don't we just kick off with, I'd love if you could just take maybe, a minute or two and tell a little bit about your background. What type of medical professional are you? Where are you located? And tell us about the practice or practices that you have.
Yeah, thanks for the invite. I guess a couple of weeks ago when you invited me to this, I was not understanding that we were live. So I was thinking we were just going to be doing some type of podcast. So good thing I did get out of my gym clothes, because that's what I was sitting in here earlier this morning. Yeah, so I've been in practice now for coming up on 17 years. I'm a chiropractor by nature, an entrepreneur by heart. I've had several businesses. Right now, we are in the midst of opening up our third location as far as chiropractic goes, in regards to having StemWave in there as well too. Met Tom roughly about a little over 3 years ago. He was head of a marketing company that I believe he may still own or has parts of ownership to, that sold us on another device when he was doing marketing. And that's how I met him. And we had phenomenal results with what he was doing. And about a year and a half, 2 years later, whatever it ended up being, he had spoken to me about this company called StemWave, and how it was a focused device, and he was thrilled to bring it to market, but yet it had not been brought from overseas to the US. So it hadn't broken that barrier yet. And I was wondering if me and a couple other people would be willing to pioneer this and help get it across the border and get it out to every one of you that are sitting on this call, as well the hundreds that have already invested into it in the past. So I said, yeah, why not? I'm losing hair. I got gray hair. Let's add more to it. And so we started the endeavor. And what are we, about a little over 2 years since I first met him in person. Flew out to Pittsburgh, where Dr. T's at. He's another clinical advisor. We shot some videos to launch this thing so we could help train you guys at home from afar, not knowing that it would turn into group trainings or individual trainings. And since then, I've flown all across the country. I've been in a lot of offices helping launch and train people to get this device going, as well as hosting monthly group trainings here in Fargo, North Dakota. We were just, if you're familiar with chiropractic, we were just all adjusting for the first 13, 14 years of my career. The only thing that plugged into a wall in my office was a computer, and God help me if I could even learn how to utilize that thing properly. Usually my team would tell me to stay away from a computer, because anything that plugged into a wall, technology-wise, I wasn't the best with. So reason that we invested into the Shockwave industry originally is I was paralyzed in 2011 from the waist down, and came back through. It took me about 2.5 years to get my socks on by myself. No drugs or no surgery along the way. So in my personal belief, I believe I was handed something and tested to see if I could come through to help other people. There were remnants that had still lasted up until a couple of years ago, that when I saw the ad about the first shockwave device, I said, hey, if this thing can help me get up in the morning and get back to my job and see that I can finish my career in the way that I started it, I'll forever be grateful for it. And I will tell every single person, and I will help any way I possibly can. I hadn't felt my leg. My intestinal tract was off. And after the first several treatments, I got feeling back in my leg. I love to ride motorcycle. And I could only ride about 30, 40 minutes, and then I had to stop. I couldn't feel my leg. And obviously, if you're riding a motorcycle, you need two legs to be functioning. One doesn't really help you. So that's really how I got into it. I became the best client, and then turned that into the best I could for that moving forward, to tell people about it. So I'm happy to be here. We have 2 StemWave devices right now. As I said, we're opening a 3rd office. So Tom and I will be speaking here shortly on what we need for that moving forward. If you're wondering about the investment, I'm sure we'll get into it. If you're wondering how long it takes, anywhere from 15 to 45 days, we paid these machines off. It's just a matter of, if you're a business and you're an entrepreneur on this call, it isn't more than you just putting feet to the ground, being convinced and confident that what you have can serve the public. And I think we're going to get into more of that here today.
That's amazing. And the story is so inspiring. So let's kind of, roll back the curtain a little bit and talk about that. So, it's, I don't know, 3 or 4 years ago at this point, you guys don't have anything in your office, and, you see an advertisement, you see some people getting better. Talk to us. I can't tell you the number of people who buy this technology where the leading indicator for why they actually want it for their office is something they're dealing with themselves as a practitioner that nothing can solve for. And if it can do it for them, it can do it for their patients. What did you see when you first began trying it? What protocol were you putting yourself on? And how soon was it that you began using it on patients?
Yeah, so I mean, I've tried everything. I mean, when you're in a situation where your intestinal tract doesn't work, reproductive organs aren't working, you have numbness and tingling, you feel like you're 95 years old, but you're only in your 30s at that point when it first started. Now in my 40s, I've tried everything. I did decompression, I did laser, I did ultrasound, I did the stretches, I did the Graston, I did everything you could possibly think of besides having surgery. And the reason I didn't do surgery is, if it was already that bad, I didn't want to be forced into that position for the rest of my life. Might sound crazy to some people, but I figured if there was a way out, that was the way out. I wasn't going to be fixed into that position. So after the protocol that I started with was fairly simple. We did 2 to 3 times a week for the first couple weeks. And by about, boy, I'd have to look back, but let's just arbitrarily say, somewhere between the 5th and the 8th visit, so a couple weeks in, is when I really started noticing that it wasn't just a fluke. What I noticed at the beginning continued to get better and continued to get better. Along with having a paralyzation, I think something that should be said is, we tell our patients, we do range of motion, we do all different strength tests, anything that's a metric to start them with to see what their baseline is, right? And so here I am telling people that we have this device. I'm all excited about what it's done for my low back, but I had this ongoing shoulder injury as well too. That playing softball years ago, I was playing at first, guy ran by me, took my arm with him, and forever it was just, this is as far as I could move it. Not because I have a suit coat on, that's literally as far as I can move it, but you start living with it, right? And you realize that you're an entrepreneur, and this is just what it has to be in order to get the bills paid and keep the family fed. And so we did a before and after video of my shoulder, going, wow, this thing's even worse than my low back as far as chronicity goes. There's been 17, 20 years of it going on. I just figured that's just kind of was be ripped rotator cuff. I wasn't going to do surgery on that either, just for that's how I live my life. Sometimes I put myself through my own agony anyways. But one visit, I was the patient who, when you say raise your hand above your head, they go like this, right? They get that hand above their head, but it's because they do a lateral tilt. And that was me. I didn't even realize I was doing that because it became so accustomed to it. After the first visit, only a couple hundred waves, I went like this. No pain, full range of motion. and the rest is history after that. So yeah, I did invest into the first technology for my own reasons. I knew, and I'm that type of a person that if it's not going to work for me, I have a very, very tough time selling something. You know, I don't eat junk food. I don't drink colas. I would be a very bad spokesperson for anything that had to do with junk food and cola because I don't believe in it and making the body better. No offense if anyone on this call does, but if you're going to be well with this, I wanted to be well first. I wanted to be the first person to the plate. I wanted to live a better life. I couldn't play with my kids. I was that patient. I couldn't even throw a ball to my kids. I couldn't get off the ground. I wasn't sleeping well. All the things that our patients come in with, I was that living patient. So when I saw the videos, I'm going, this is too good to be true. And 9 months later, I finally invested in the first device after talking to Tom's team, and it was 9 months too late. I still to this day kick myself and go, man, they didn't change the technology in the 9 months. I just finally changed my mind. How much of that would I have got back? And since then, we've invested in 2 more. So we have 3 total devices that I'm happy that we have because it keeps myself moving forward. We're helping hundreds of people on a monthly basis. And, you know, when you look at it, what it does for the community, and it's an exchange of value, we're getting, you know, reimbursed nicely, meaning cash wise from the people as well, too. So the investment's a no-brainer. It really is. I'm telling you firsthand, I waited 9 months too late. And I wish I would have invested along for my own health. And now I can still use it for myself. And the machine's been paid off over and over and over again. We don't look at somebody as a dollar bill coming in. It's an exchange of value.
And at what point did you realize, because you got the device and you really were your own patient one? And what we were telling you over the phone and what we were telling you when, you know, when we were meeting you was, hey, you know, we promise there's hundreds of patients, if not thousands, that are using this. And then you got a chance to use it. You got it in your office. You used it on yourself, not only on your shoulder, but your low back, your leg, and you started having a pretty incredible experience. At what point did you begin using it on other patients, and how did that look for you?
Well, I guess I would consider anybody that's not me to be another patient. So my team had no choice. They became the next in line. I became so excited. I'm like, just let me see if I can get a baseline for you. Let's see. Maybe there's something going on that you don't even realize is the next 3 to 5% of increased range of motion or better strength. But when it came to actually working with the public, by the time it was delivered, the first unit was delivered within about 10 to 14 days, we were working with the public, confidently working with the public after our first training, you know, shortly after that. So it was a very, very quick turnaround, you know, especially in relation to what you see with a lot of this other equipment. Is there somewhat of a learning curve? I don't know what to say with that because I never dabbled with anything other than my hands for adjusting chiropractically. But I talked to people with lasers. You know, I'm coaching a lot of people that have lasers and decompression. A gentleman the other day on one of our coaching calls, you know, has been using lasers for neuropathy for a long period of time, and he's telling me these amazing stories that he's getting with just StemWave alone that he's never even used the laser for yet, and he's done laser for years. So I can only go off of what everyone else is going and saying to me on, you know, things that I've never used as far as modalities. But as far as getting it on somebody, really not 80 to 90%, that's an arbitrary number, but really a high margin of utilizing this device is just putting it on the area. It is, no matter how many years you've been in practice, no how many years you've been in life, I believe they're just touching base on what inflammation is doing to the body. And most of it for years has been what? Rest, elevate, ice it. I mean, that was their cure for inflammation. Now we have this technology that's localized, can go right to the source, and within seconds of their visit, a 1 to 5 minute visit, within seconds after that, they get range of motion, they get confidence, they get stability back into a joint that they haven't had. You know, and to see the tears and to see the testimonials that come from this, it is something that just hasn't been seen, and I'm glad that it's on the market.
And I remember so vividly, you were an early adopter of this technology. You know, a lot of people across the country did not have it at that point. You were very new to it. You were, of course, the first person in your market, maybe even in your state, heck, maybe the Midwest. And quickly, we began seeing videos, and these videos were of patient after patient after patient. And what we thought to be a miraculous case turned out to be a common occurrence. So I'd love for you to talk to about what are some of the individual case types that you were seeing? Obviously, you had a shoulder and a low back. What did your office have? What were the types of cases that you began confident to treat with? And now to this day, you can bring it forward, but how are you using it?
Yeah, I think before I answer that, something that you touch base on that I should touch base on myself is I am not an early adapter in anything else in my life. Uh, I had an iPhone 4 when everyone else had like an iPhone 12. I do not follow technology like that. I wait to see if it breaks before it actually can be fixed and if it was right in the first place. So for me to jump into this was a wonderful conversation with myself. Sorry for that sound. We got the Blue Angels flying through our city right now. So I can't help the air show. But yeah, I'm not an early adapter to technology like that. I wait to see what it is. But with this, it was if it does it for me, I'm in. And that's why I jumped on board with this. But as far as cases that we see, if you're not a podiatrist, you could be a podiatrist for 2 weeks straight and then do different marketing and bring someone else in for a different body part. Plantar fasciitis, frozen shoulder, epicondylitis, knee issues. It depends on your license and your board of what they allow, but there are medical doctors who are able to take care of soft tissue to bone issues, helping with the healing process. We see right now, if I would name a top 5, we are at shoulders, we are at hands, wrists, we'll use that as one, hips, meaning like your femoral head. That's what I mean by hip with this. Knees, feet, and if I'd throw in low back, sacrum, coccyx area. When you invest into this, I'll be confident. When you invest into this and you have your own low back issues or you have patients coming in, I will tell you the femoral heads and the sacrum, coccyx area are something that we were just never really, we never honed in on. We weren't taught about as much as you'll find that this device has changed. It changes everything of how you look at the body. It really, really does. As a chiropractor, I was all straight up with spine. I'm doing more things with the coccyx and the sacrum and the femoral heads as far as the greater trochanter than I did in 13, 14 years before this. And we are seeing results that you just can't even explain sometimes. It's so much that you can't explain it that when they walk in, you just know it's going to happen. Like you're expecting. We've seen so many of these cases now, you're just expecting it. We had a gentleman who came from Long Island University, broke his arm playing a hockey game, Division I hockey player. His school took his scholarship away. This is a recent one. Took his scholarship away because they didn't know if he'd ever return to literally playing ever again. He came into our office holding his arm like it was a cast. It was Popeye arm. It was stuck, chronic inflammation after 6 months of surgery. The only thing that he had was a PT telling him to try to move his wrist. He couldn't move his arm. His thing coming into our office wasn't get me back on the ice. It was, will I ever hold my kid? Can I ever have a full-time job? He couldn't move his arm. Based upon what we know with this technology, we sat him down, we mapped him out, and he couldn't even do a push-up. This is a Division I athlete, you guys. Couldn't do a push-up coming into our office, had to go to his knees. After his first visit, he could get down to his knees and push up. After his 5th visit, he's doing 5 push-ups. Now, a month and a half in, he's talking to the school. He talked to the coaches last week and he's waiting for his scholarship. They said by middle of November, if he can play, he gets his scholarship back, and the kid's flying. He's doing everything he was a year ago. So I say that to say we brought that case on in such a complicated manner, but we treated it and mapped it out on the initial day with confidence, knowing that if we found XYZ, we can help. And we told him by July 1st, you will be 80% better. And this is when we met him in the middle of May. 1.5 months after treating him, there's a different protocol for it, but 1.5 months treating this Division I athlete, trying to make pros, we got more results in 1 week, not a month and a half. We got more results in 1 week than he had in 6 months of rehab, PT, OT, and every other thing that was under the sun. You just can't explain it until you actually see what the detriments of inflammation do to the human body on levels that we have not been able to control or even look into because we've never been able to control them. So yeah. Ankles, knees, wrists, elbows, shoulders, spines. you name it. If there's inflammation involved, it's time to get after it.
So you mentioned a couple words here that the audience may not be familiar with, and I'd love for you to walk through it. You mentioned a word, mapping.
Yeah.
Why don't you talk about what mapping is and what expectations you have in the first few visits for a patient?
Yeah. So mapping is essentially their foundation. You don't know yet that you can help them or not help them. We're all brilliant in what we do in our own industries, but you're not yet sure that inflammation is a true factor to the degree that you can aid the body in removing the inflammation, as well as promoting a healing response to a desired result in the predictable future. So on day one, what we're looking for when someone comes in, let's say it's your shoulder, we have you go through range of motion, strength, whatever it be. We video that or just simply take pictures of everything. So we have metrics. We'll treat you, which can take anywhere from 30 seconds to 5 minutes, depends on the areas or area. And then we'll reassess you with those metrics again afterwards. If we see a 5 to 20% improvement based upon what we did, we know now moving forward, we have predictable results coming our way. We're expecting on an ongoing daily visit when they do come in, a minimum of a 5% improvement. Now, mind you, I'm not saying every single time they come in, they're getting 5%. It might be 0, 0, 20%, 0, 0, 30%. We see that all throughout the health industry, right? Not every day is their best day, but the accumulation factors is what you're looking for along with that. So the first couple visits, you can expect the first visit anywhere from 5 to 20% minimum. Now I say minimum. The reason I say minimum is because the world has seen all these wonderful videos. Not everybody's created equal, right? In regards to how they're going to come through, what they're coming through, but it's not uncommon for you to see these 50, 60, 70, 80% improvements with individuals to the point where they're going, this was the absolute youth that I've been looking for. You have the fountain of youth in this device and they just don't want to return. But it's a healing process. You have to educate them on that side of things, is what you did, what needs to occur, and how often they need to see you. But yeah, the greatest thing about this device is it gets amazing results in such a short period of time. The difficult part about this device, it's not difficult, it's just fun to say, is that you just got to educate the person on the healing process. And so what I'd advise anyone on this call is don't complicate it. The medical world has made a wonderful dent in the community, in society in general, in what healing is, because science is out there. It takes roughly anywhere from 6 to 8 weeks minimum for the body to come through something, upwards of 12 weeks, right? You put somebody in a cast, what occurs? The first 4 to 6 weeks, they're in a cast. What are they doing? They're stabilizing. After that, what are the next 6 weeks? They're going through rehab. Don't complicate it. You're just utilizing a tool to help them heal better by removing inflammation. You're not changing the laws of the physiology.
So you mentioned something interesting there, which is you're looking for a sense of improvement in that first visit, anywhere from 5 to 20%. Of course, it could be more than that, and then thereafter. And it sounds like you use that as a qualifier to understand if they're a good patient for you. Is that right?
Yeah. So if they don't get that 5 to 20% improvement, we either invite them back for another visit or two. We have a rule of 3 within the first 3 visits. If we don't break a 5 to 20% improvement on whether it's subjectivity of pain, whether it's range of motion or strength, or a combination of the 3, then we know that there's not enough inflammation in that area for us to work with, or we are yet not qualified to work with them because we don't have the skill set to identify what's going on. But if we find a 5%, and the reason I say 5 to 20%, some people are going, what might think like, well, that's not that big of an improvement. 5 to 20% is a home run with a lot of these people. And the reason 5 to 20% is because they're also going to see the videos or hear about them coming into your office. And if they don't hit 60 to 80%, if they're not jumping on a trampoline the next day after 20 years of degeneration in their knee, they're going to say it didn't work. So we minimally allow them to have a standard of expectation. That's also our expectation. And then from there, we just follow the steps moving forward. That I think the biggest key, Tom, is predictability. I've never seen something so predictable in the health profession. I really haven't. I mean, I've been in and out of surgical centers. I talk to a lot of medical people as well too, dentists, everything across the board. This has such predictability that you can either qualify someone or disqualify them within those first couple of visits. And here's what is great about that. You're not selling something on to somebody. They're coming in, people want to be qualified now because they're sick and tired of being sold on everything. Let's try this. Let's do this for 3 weeks. Let's do this for 3 months. When they come in, we are stone cold. If we don't get these expectations hit within the first 1 to 3 visits, we don't think you're a qualified candidate. Thus, at this time, we wouldn't be working with you with this specific device. And it's wonderful to see the reaction that the society has with that. And some people, it's unfortunate because we are their last resort. They've gone through everything. But the fact of the matter is, there's predictability with this technology.
So on that note, you've worked with enough offices and you've worked in your community enough to know what percentage of patients should qualify. So as a general standard, I know there's no perfect answer here, but for most offices that are dealing with chronic and acute musculoskeletal conditions, joint cases, whether they be, a physical therapy office, a chiropractic office, regenerative medicine office, pain management office, generally speaking, what percentage of patients can you expect to see improvement in those first few visits?
Yeah, I'll start with this. When our initial skill set was what initial skill set was, I thought the numbers were 60 to 70% because that's what we were seeing coming through. That 60 to 70% of the people were getting improvement. Fast forward 3 to 6 months after utilizing the device, understanding inflammation more, understanding where it sets into place. That number is 80 to 90 plus now coming through the doors. Now that's arbitrary, right? And it's arbitrary because it's skill set dependent. But really, most of the individuals, here's what I would say to anybody looking to invest into this or just understanding more about inflammation in the areas that we're working in. Everybody deserves a baseline. They're doing a baseline for hearts, blood pressure, everything across the board. People are looking for baselines every couple of months to every year. There's no reason that this device should not be seen as a device that can provide a baseline to see where somebody's functioning and where they're feeling. And if they get enhancement on that visit, then they're a qualified candidate for whatever you see is a predictable future by continuing to utilize this. So for me, we don't really look for who's qualified. We look for, let's get as many baselines as possible. That way, when something happens, because something's going to happen in someone's life, we can then utilize this device to come back and say, hey, you were able to do this in January of 2024. It is now December of 2024. You don't have the same range of motion after your injury or whatever's been going on. You are a qualified candidate now. Here's what we can do because we got a predictable result. But if we look at numbers and numbers alike, it's easily 80+%. And the better that you're with this, you'll find it's even higher than that because there's just so much hidden inflammation that we've just never been able to touch until now.
Now, a lot of concerns that people have in speaking with many different doctors and all different types of medical professions across the country over the last few years is, well, that sounds phenomenal, but I didn't study this in school. I'm not sure how this technology works. And so in your experience, not coming from a background where you learned about this years ago, you didn't go to school for this or anything, and you've worked with a lot of offices, how hard was it to learn it? Where did you start? Where are you now? How has your staff gotten involved? Give us a lay of the land with the complication of using this technology.
Yeah, I mean, honestly, if I put it in your hand and I was standing next to you and I said, put it on your knee or put it on someone else's knee and they had inflammation without even knowing what to do, as long as you were in the vicinity, you'll get a result if they have enough inflammation to work with. So that's really how easy this device is. Now, fast forward with that, take a little bit of the online training, the group training, or in person, whatever it be, and then you quantify that moving forward. So I'll take it as this. The individuals who come here or go to Pittsburgh for a group training have yet to typically use this device. And they get their hands on it for maybe 3 to 10 minutes at the group training. Everything else is discussion, and I demonstrate and I show them how it works. Within 3 to 10 minutes, they are confident enough of watching everything before and using it themselves to go back to their community and start treating people. Now, here's the caveat to that. The skill set comes next, and just like anything else, takes 10,000 hours to perfect something, right? So the frustration level is no frustration level. It's just the better you get, the better you qualify, the better results that you get. So there really isn't, so to speak, a huge learning curve, because just simply putting this on the right area and finding the inflammation and keeping it there. So this isn't the biggest concept that I would tell for most people that they'd realize and can relate to this is most people understand what ultrasound is. If you use an ultrasound device, you have to constantly move it. That's because you'll cause damage if you don't move it. With this device, we're actually going to tell you to make sure you keep it on that area, not to cause damage, but you can focalize it by barely moving it in a different vector to create a result without creating any type of ill response. So it's more of doing less to get more. And it's right back to really what it's a principle of life, right? The less you do and the more focused you are, the better results that you get in anything in life. And that's what this device is. It's beautifully created because it is physics. It's physics. Like, it wasn't created, it's physics. And it's a law that aligns with the human body.
Yeah, and Dr. Barton mentioned something key there, which is when you run this over areas of damaged tissue or inflammation, there will be a reaction from the patient. You will know. Dr. Barton, I'd love for you to talk about that, because a lot of people have just seen videos of this, but they've never seen it really used on a patient. And could you talk a little bit about the biofeedback component and maybe how that's different from what some people have experienced with a laser or ultrasound or manual therapies?
Yeah. So yeah, as Tom said and alluded to, there is a biofeedback component to this. Now, the biofeedback is directly controlled by you, the provider, or the technician, whoever's utilizing it, meaning that the intensity to which you're implementing and putting into the human body, you can decrease or increase that in order to get a biofeedback or a response from the individual. Now, this is key to understand because the biofeedback is directly underneath the applicator head. So the device that looks like the big flashlight, if you've seen it, it's directly underneath that. There are other devices in the shockwave world that when using, it's not directly underneath it. And the threshold to which the patient can handle the visit is nothing close to what StemWave experiences. That's the reason why we have 2 StemWaves versus the first mentioned device that we invested into 3+ years ago. The patients literally couldn't handle the treatment. If they can't handle the treatment, they can't get the result. With the focus device with StemWave, when you're putting in the waves, there is a biofeedback. So at the beginning, if you're not used to using this device, the patient will feel when you're over tissue that's inflamed, and they'll say, oh, that is a painful response. Our words to them are, we want anywhere from a 1 to a 5 out of a 10 as far as the pain scale goes. That's the biofeedback we want. We want comfortable. We want you to be able to have a conversation with us. We don't want you sitting in the chair, gritting your teeth, hoping that the visit is done. That does not need to happen, but you will see that there's a biofeedback, but it's a comfortable biofeedback. And then as you get better with this, you'll find that the body breaks down in certain ways with inflammation, and you don't always need the biofeedback because now you're that skilled surgeon that just knows that they know that they know, and you can test your skills on that and say, hey, here's where it always is. How do you know if you get the result? Because you do it before and after all the time. But biofeedback is a component. If you're wondering where inflammation is at, there will be a biofeedback that the patient does feel, or you can increase the intensity to see if they can feel it. But not all times will they feel it. And just because they don't feel it doesn't mean they won't get a result. But many times the biofeedback gives you a great indicator at the beginning that you're in the right spot.
Now, how does that biofeedback and level of precision change things for you as a medical professional in comparison to, someone who maybe doesn't have that and, they're addressing a chronic or acute condition without knowing precisely where that inflammation may be?
I think the best answer to that question is we now have we've been through so many different patient visits that 3+ years now into the industry, I don't look for a biofeedback because the biofeedback showed me so many times over and over and over and over that this is the place. The body breaks down specifically like this, and we're going to do it whether you have a biofeedback or not. I know if your body is going through a knee issue, it's going to be in these 3 to 4 places. If you have a shoulder problem, I can tell you got to go to these 3 to 4 places. And that's exactly what we coach and what we train you guys on as well, too, is that because we found the biofeedback thousands of times over, we can now go to the areas without biofeedback. And that's how we can show you that proof. This is how the function of the body actually is working and not working. And here's where you're going to find inflammation versus not find inflammation. How do we know that works? Because we got thousands of testimonials. We got thousands of videos showing the befores and afters of this. So I think it's more of now seeing where we're at to explain how did we get there.
Wonderful. And, you know, a question that I get a lot is, that all sounds great and that all sounds good. I'm confident in the technology because I've read the research. You know, there's over 10,000 studies that have been done on this technology globally. You know, with regard to its efficacy, you know, that should be the least of the questions. But I'm busy. I run a practice. It's hard to integrate new things. It's hard to get new things set up. So could you touch on how long these treatments take and how you structure a calendar to integrate this into a practice that does not have anything like this currently?
Yeah, so I'll address it with this. Our chiropractic side of things for 13, 14 years before investing into the first shockwave device, our visits are anywhere from 30 seconds to 5 minutes. So we actually had to go on the other side and figure out how does this work coming into our office now that we have to schedule 10, 15, 20-minute appointments, meaning a day one, however your process goes in your office. Right now, we operate 2 different rooms. One is an overflow room, which is we take only an individual who has one area that we need to work on. That takes anywhere from 1 to 5 minutes to work with them. Really, most of the time is getting them into the right position, having the conversation and kind of standing by the door and having them move on to the next thing. When it's an ongoing process, a case that we're taking on, you can expect bumping up to roughly 15 minutes if you're working with 2 to 3 areas, because you're going to have a consult essentially each time they come in. You're going to do befores and afters, and then you got to treat the area and make sure, you know, you do the after to see if they got improvements. So you can expect a solid 15-minute appointment ongoing if you want to schedule just consistently. Our initial days, we can easily do consult, treatment, financial, all within 15 minutes. That can be done. Can be done. We've now moved to 20, 30-minute appointments just because we've been doing it for so long. We know exactly how someone's going to react in certain scenarios. We've literally got it down to if somebody has a knee, we understand what the value of a knee in this area is. We now understand what somebody will pay for a shoulder, and they're different across the board. People value different body parts, not because it's a body part, because of what it does for them in their life. They value that kicking a soccer ball or walking with their wife is more important than throwing a baseball or sleeping well at night. It's just how it is, right? It's a value system. So that would be really, what we've done with that moving forward.
So it's 15-minute visits. You can almost get everything done. Maybe it's a little longer sometimes. If you run a little slower in your office, it's about 20 minutes.
Yeah.
But at full ramp, you should be able to see anywhere from 3 to 5 patients per hour, really depending on how fast your office likes to move. And with that in mind, if you're thinking about 3 to 5 patients an hour, that's a lot of patients. And so this doesn't necessarily take a lot of time unless you want to do extremely high volume or even just relatively high volume, like Dr. Barton's office. So why don't we talk about how you're charging for this technology? Because a lot of people have either never charged cash before, or they've charged cash but not for a technology. They've just never built anything like this, and they're a little unconfident about how it might work. So I'd love for you to touch on the financial piece and what you train our doctors on.
Yeah. So when we first started with this, it's a 2-part answer here. When we first started, and when you're all going to be starting with, you're going to be working with people you already have a rapport with. And because you have a rapport, they're going to trust you differently, and they'll value your services in the past to be equal to what you say you're going to do in the future. So you're going to be able to confidently ask for a little bit more of an investment on that side of things. However, I would caution you with that because we weren't trained prior to all this. That's why we do a lot of training with StemWave now. This wasn't a training, so we started there and then we had to revert backwards. Currently, so at one point, we were easily able to charge anywhere from $250 to $550 a visit. And this is cash. We are an all 100% cash office, Little Fargo, North Dakota. Our state population is only 700,000 people. It's not like we have a lot of people to grab and pull from. And now we're down into, and I don't say down, but now we found our groove. We're anywhere from $59 to $300. So the 59 is our initial consult. We just want to have a barrier that's easy to, enter. They can come in. $59 isn't going to break most people. It lets them to meet us. It allows us to see if we can help them. And then from there, we can decide what comes next. As far as ongoing treatments across the board, roughly $100 is what a lot of people are pushing out there right now. What I would say to anybody listening to this call, whether you have the device or don't, whether you're having tough time figuring out your price point or not, whatever your current best service is that's cash based, that's, let's say 60% of the services that you render, take that times 2. And that's a typical number that most people are willing to say, I will pay that for one visit for ShockWave. So for us, we're roughly about $60 for a chiropractic visit. Take that times 2. We have no problem selling one visit for $125. And then what we do is we do add on per area. So we treat up to 3 areas. I advise 2, especially at the beginning, just so you can get your confidence down. 3 is a little bit more complicated because you're having to put more factors into it, but 1 to 2 areas is what you'd want to treat to start with. You stick with the protocol. We do a time by time fee, and then we do a prepay fee. Now, I can't tell you what to do in your own states based upon your licensing and your board, so you have to look into that because there are different regulations. But I would advise that you do a one-time by time fee, and then some type of monthly or prepay option if you can do that. Here's the reason why. We've seen enough people to realize that the results happen so quickly that they'll try to wait 5-6 weeks for no visits, and they'll come back in 5 or 6 weeks and try to get that $150 visit because they know it works so well, when they've missed 6 weeks worth of investments that would have got them to where they're at in a much better place. So I won't say the word penalize, but you got to use some business smarts when it comes to it, of what people are trying to do to take advantage of something that's so well. And the protocols work by number of waves, number of visits over a period of time. There's no magic bullet. As great as this is, it's not a one-time fix-all. So as it comes to financial part of things, don't deviate too far. If you're good with what your cash services are right now, don't deviate too far from what you're already doing. Don't make it chaotic. But if you're running a big insurance-based office, those are some great questions to ask when you come to the group training, and then even before, because there are some strategies that can make it a lot easier. And most of the time, it's just confidence of the doc. And most of the individuals, what they're selling, they don't believe in themselves. It's that they've seen it in a video. So that's why I said at the beginning, look to find someone you know, love, and care for, or yourself, that gets some type of a result, so that you can see and know that that's a predictable for the future for everyone else.
Wonderful. So for the last 13 minutes that we've got here, you guys, we're going to shift to Q&A. And so wherever you are, if you're on Facebook, just leave a comment in the comment section of what your question is. If you're here on Zoom, you can just leave the question right in the Zoom. If you're feeling confident and you're on the Zoom call, you can even just unmute yourself, come talk to us if you'd like. But yeah, shoot a message in there. I've got a list of questions. And as those messages are populating, I've already got a list of them from people who commented before the call even started. So I'll list off some of those while you guys are shooting them. But before we get to that, one question, a final question that I would ask you, Dr. Barton, is so many people look into this technology, and they're looking into it for all the right reasons. They're looking into it partially for themselves. They're looking into it mostly for their patients. They're looking into it maybe as something that could help their business, but ultimately, they're just not sure. They're not sure if they're going to be able to do it. They're not sure that they have the time. They're not sure if it's really going to get the results for their patients, but they want it. And for months and months and months and years, they'll call our team, and they'll want to see if we got any new studies for them, if we've got any new case studies that they could look at, if we've got anybody near them that they could try again for the 3rd time. What would you say to that person who maybe has been looking into this just like you were for months and months and months and months, and has read the research enough to know it's the right thing for them, but ultimately is on the edge of pulling the trigger for whatever reason it might be.
Yeah, I think the ones that are sitting on the outside wondering, I did too for 9 months. However, here's what we looked into, and one of the reasons why we waited 9 months is we wanted to make sure that we knew how to convert from never using technology to then utilizing it and what that looked like in our practice. And we set it right with our expectations and objectives for our business. So if you're wondering, is this right for me? Most people that are skeptical, and I'll straight up truth, right? And same with our patients that come into us, it's because they made a decision in the past that didn't align with their values and because they didn't know what their values were. If your value is health and your value is, I have patients right now who I know I can serve better, or I know there's something going on with me that I haven't been able to take care of. What if? The what if, and the reason you're on your call is enough to invest into this. It really is. I look back at myself and go, if in 2011, this device would have been around, what would that have meant for my life? I mean, years of just sitting around that I couldn't do certain things that I just overnight was taken from me. I wasn't supposed to have kids because of what happened with the paralyzation. I have kids and I will do anything for my kids. It's one of the reasons I'm on this call, is because I've helped them with their little broken bones. I've helped them with a pitcher's arm that's, a 9-year-old, my son, who's sore afterwards. So look into what you value, look into your patients. But most importantly, what I would say that became our final decision, if you're willing to go to this level as a doctor or a business owner, look back to all the conversations or the current conversations that are being had in your office by your patients saying they're going to a massage therapist, they're going to acupuncturists, they've been doing MRIs, they've been doing CTs, they've been doing all these other tests and analysis to figure out what's going on. But none of them have ever talked to you about, what do you think about localized inflammation? And then the question to you would be, what about that localized inflammation? What are you doing for it right now? And if you don't have an answer right now for localized inflammation, then I would say whatever is going on right now with StemWave that you're wondering what could go better in my office, I would say most definitely just take the leap. Trust me, I'm a little guy in North Dakota. We paid off all of our devices within 45 days. It is not complicated. When you have a desire and you have a want and you have a good rapport in your community, which, not to age any of us on this call, but I don't think most of us aren't in our 20s, just fresh out of school. We've built relationships in our community that when this device is presented to them, we're starting to get Division I colleges asking us to come to their schools. We're starting to get schools to ask us to come to them. We're getting nursing homes that are saying, how can we get this in our nursing homes because we can't get our people to you? It's just a matter of conviction. And can you convict yourself that making this decision is what you need? And I don't make $1 off of this if you guys buy one. I'm just telling you, I waited 9 months to buy my first device, but I wish it would have been available in 2011 because I know what I missed in my kids' lives. And it bothers me every single day, which is why I get on these calls, because I'm here to tell you, stop procrastinating. Sometimes it's worth jumping into something like this that you just believe is the right thing. And when you make that decision, you will realize when you make that decision, it was already too late anyways. Because you're going to say, just like I did, I heard about this 6 weeks ago. I should have bought it then because look at the results. Mary came into my office. I could have had her much better XYZ. So my thing is conviction because it works.
And by the way, it'll never feel perfect. It'll never feel just right. That's never how decisions feel in business. And to Dr. Barton's point about years ago, he felt helpless in his situation that he was in with his, physical limitations. Dr. Barton is by no means alone. And many of you are not in the market currently where you are helping those types of cases where Dr. Barton was dealing with. But the truth is, a majority, I would vote to say, the CDC reports 50% of America, it's probably more, are suffering from some sort of chronic or acute musculoskeletal condition. And some of you guys, whether you're a physical therapist, chiropractor, or pain management clinic, whatever it might be, some of you guys are helping a percentage of those community, but the truth is the percentage of the community that you're actually helping is much smaller than the actual community that needs to be served. And this technology is a beacon of hope for those people who need it. It's the only opportunity that they're going to have many times in their life. And so if you can be that person for them, it'll change everything, and the rest follows, really. So we'll dive into these questions. We have the first question came in and said, I'm looking into laser. I'm thinking about investing in these two technologies. I know, Dr. Barton, you don't have direct experience with laser, so or you didn't use it in your office, but you've worked with hundreds of offices that have used it. Why don't you talk a little bit about your opinion on the two, and I'll also help answer that, just because I have experience with both as well.
Yeah, so I have great friends who have a shockwave device and have laser as well. They're using laser before shockwave, and they are now using 90% shockwave. As I just alluded to at the beginning, you know, there's a gentleman who just recently invested into one of these technologies, StemWave, and he's doing a neuropathy protocol. And now he's finding that with the StemWave, he's getting results that he never got with the laser. Now, with that being said, and I'll just make this clear for time's sake as well too, it's not that you can't use both devices. If you already have one, it's not that you can't implement them both. But from what I've seen and what I've heard for those that have used lasers for years, and then they now get a StemWave, they're putting the laser to the side. And they're using it, they were using the laser to try to get anything and everything, and it just wasn't always getting its result. Where StemWave, they're finding that it was a true inflammatory response to which this technology can truly be a wonderful solution for, and they don't have to use the laser like they once did and get way better results with now using the StemWave. So I'll use it more from a practical standpoint. I'll let you answer the rest, Tom.
Yeah, I mean, to that point, probably about a third of our doctors have a laser device when they purchase StemWave. Okay. So they're buying it with the intention of upgrading what their current situation is. And the upgrade that they're normally looking for is, my laser gets good results, but it doesn't get great results. And as a result of not getting great results with everything, I have priced myself into a much lower market than I had intended. And I'm not as confident with it as I thought I would be. So like I said, a third of our doctors, maybe more, have a laser when they come into StemWave. Once somebody buys StemWave, I have yet to find a StemWave provider of the 400 plus that we work with who has bought a laser after they have a StemWave. If that answers that question. And if that wasn't enough, by the way, I commented a 50-minute YouTube video that we put together, which goes through all the studies. It's a deep comparative analysis between StemWave and laser. So I'll jump to this next question, which is, do you mostly sell StemWave treatments to people who are seeking chiropractic services, or do you provide them to people seeking other care like primary care?
Yeah, that's a great question. I mean, we market it currently. We're doing marketing in which they are scheduling for just a shockwave StemWave visit alone. And then we marry anything else that we know that would be best for their case. So there has to be a reason for them to come in. And anybody on this call that understands the word chiropractic, everybody has a preconceived notion of what the word actually means versus what I know it can do. That's the same way as the public. So we utilize different marketing efforts individually as well as packages in regards to attract people to come into the office. So you know, we first started where it was all just StemWave marketing, and we had attracted a great deal of people, and then you find a different strategy. The community shifts and moves. I guess the best answer is understand your community, understand the conversation in the mind of the consumer, and watch how the you know, ebbs and flows go. But there's no right or wrong way. You can capture their attention by making combinations or just individually.
So, and Leslie, you mentioned you'd like to speak as well.
Yes. Hi, everybody. Nice to meet you. Nice to be on this call. I just quickly wanted to butt in regarding the laser. So I have a laser clinic and I've been doing laser therapy for 11 years. And I've done these protocols. You have to do like 45 minutes of laser to really get results. And I treat practically everything from acute, severe, and so forth. So when I got StemWave, I was very excited because it shortened the time. And I've been using our device now for 2 months, and I have to agree with everything that you guys are saying. It is way better than the laser. And I've done laser, as I said, for years. Now, there's some things I specialize in trigeminal neuralgia, which is the face. facial pain and TMJ. So obviously for that, the laser is going to be good. I don't know if, I mean, you're not allowed to go further than C3. So I don't know if that's ever going to change with TMJ, if we'd ever be allowed to put it there. I don't know. So I'll be happy to see if you have any kind of results or studies on that. But for those who are thinking, you know, should I get laser? Should I get StemWave? I definitely would start with StemWave. You're going to have a much better result. You're going to have, it's going to be much faster for you. Your patients are going to get better results. It just depends, what do you want to do? If you want to do face, yeah, then you need lasers, obviously, right? But otherwise, if you want to focus on knees, shoulders, backs, StemWave is unbelievable. Every time I do it and people, my patients come in and they say, oh my God, it's amazing. I can move my shoulder right away, or my knees are better, or my hips. I mean, it's unbelievable. So I've had referral by, I treat like one, like a mom, and then suddenly she'll refer her father and her grandfather, and her daughter comes in, and it's just, it's amazing. So anybody who's just thinking about it, 100%, this is a great, great investment. Don't think about it any longer, because I promise you, it's way better than anything that's out there on the market. So I thank you all very much for bringing this device to market. It's been amazing. So thank you.
That's wonderful.
Yeah, I am so grateful that you just came forward to share your experience with the laser and StemWave. And I honestly can't think of a better note for us to close on. That was perfect. So with that being said, I first and foremost, I want to thank everybody for coming. I hope this was of value. I know this is a very deep and complex technology and topic, and so there's a lot of questions to be answered, but I hope, if anything, this provided enough value for you to understand what the technology does, how it can help you, and hopefully answered some of the burning questions that you guys had. If you're new to our process and you're new to learning about StemWave, I'm going to drop a link in the Zoom chat where you can book a call directly with our team right now. Didn't mean to drop your name, Leslie. Here you go. There you go. Now I dropped the link. All right, so you can click that. It's just stemwave.com/contact. You can book a call directly with our team. It's not a typical sales call. Transparently, we do not work with every office. Every office that we work with, we evaluate deeply just to make sure they're a good fit. Reason for doing that is anybody who tries our office or tries our technology, they can try it for 60 days, generally at no cost to them. If they don't love it, they don't have to keep it. Therefore, we do not work with every office. So the last 400 offices that we work with, we've had a 98% success rate as measured by clinical and financial outcomes. And so if you'd like to find out if you could be one of those offices, if you'd like to find out if your patients could benefit from this, I'd recommend booking a call directly with us. If you're already speaking to somebody in our process, many of you have already spoken to our account executive team, and you have somebody you're working with, you can just message them back directly. They know we have this live call here today. Many of you have already, confirmed with them that you're attending before this, so you can just message them after and speak to them. And if you have any further questions, we'll be hosting more of these in the future. But again, I hope this was valuable. And more than anything, I want to thank our special guest, Dr. Barton, and our second special guest, Leslie. That was incredible. Thank you for that as well. So both of you guys, thank you so much. And we'll close there.
Thank you much, you guys. Look forward to meeting some of you soon.
Thank you, everybody. Bye.